Hello, I'm Dr. Soumya, gynecologist at Akkineni Hospitals. Hope you're in good health. Let's discuss some essential points today. Stay with us and make notes.
Have you ever looked in the mirror and just wondered where all your energy went? Welcome to The Explainer. I am absolutely thrilled you're here today because we're going to be demystifying exactly how our bodies age. And more specifically, we're diving into the fascinating science of personalized longevity and the incredibly critical role of hormonal health. We've actually pulled together some brilliant insights from the experts at Akkineni hospitals to show you what is really happening beneath the surface as the years go by. Okay, let's dive right into this. I want you to honestly think about something for a second. Why do so many of us just accept feeling persistently exhausted or losing that daily motivation? We treat it like it's just an inevitable, perfectly normal part of getting older. I mean, we just brush it off, right? We tell ourselves to push through the fatigue. But what if we've been looking at this entirely the wrong way? To really get a grip on this, let's look at two incredibly relatable experiences. Take this 47-year-old woman. She's dealing with crushing exhaustion, frequent hot flashes, unexplained weight gain, and she's just feeling emotionally overwhelmed. She literally feels disconnected from her formerly energetic self. Or consider this 54-year-old man. He's experiencing declining energy, noticeably reduced muscle strength, low motivation, and a very real loss of confidence. These are typical, everyday patients walking into a clinic, and both of them just assume, well, this is just what aging feels like. So, is it just normal aging? That is the million-dollar question. It's so incredibly common to assume that these life-altering physical and emotional changes are just the unavoidable toll of the calendar. But actually, modern medicine tells a very, very different story. Researchers and clinicians are increasingly recognizing that these exact symptoms are heavily linked to something completely treatable: hormonal imbalances. So let's define the science here so we're all on the same page. Hormones are biochemical messengers. They're produced by your endocrine glands, things like your thyroid, ovaries, or testes, and they travel throughout your entire body. Think of them kind of like the conductors of a massive, intricate orchestra inside you. They regulate absolutely vital processes like energy production, sleep, metabolism, and mood. The biggest takeaway here is that your hormones operate as a tightly interconnected network. Just one small drop in production, literally one out-of-tune instrument, can create a massive cascading effect across your entire body. And when we break down the specific players in that orchestra, you start to realize just how much they control. Estrogen, for example, isn't just about reproductive health. It is absolutely vital for your bone strength, your cardiovascular function, and your mood. Then you've got testosterone, which governs muscle strength, energy, and libido. Your thyroid, that dictates your metabolic rate and energy production, while cortisol is busy managing your stress response and inflammation. These chemical signals literally govern everything from our physical strength right down to our emotional resilience. Which brings us to a really critical age range, 45 to 55. This number represents a massive health shift. It's the typical window for the menopause transition. This is a natural biological shift that triggers a steep decline in hormone production, particularly estrogen and progesterone. And yet, despite being a universal human experience, and honestly, despite a surprising number of doctors historically receiving pretty minimal specialized training on it in medical school, it remains incredibly under-discussed in our society. The multifaceted reality of menopause goes way beyond just your period stopping. It brings widespread impacts that can totally derail daily life. We're talking severe vasomotor symptoms like hot flashes and night sweats, frustrating brain fog, agonizing sleep disturbances, and vaginal dryness. But even more critical is the invisible risk: rapid bone density loss that leads straight to osteoporosis. The good news, though? Appropriately prescribed hormone therapy can actually preserve that bone density and significantly reduce those severe symptoms. But hey, hormonal decline is definitely not just a women's issue. Remember that 54-year-old man we talked about earlier? As men age, they experience a gradual but highly impactful decrease in testosterone. This shows up as persistent fatigue, a lower libido, decreasing muscle mass, paired with increasing body fat, and real noticeable changes to mood and concentration. However, and this is crucial, not every tired man requires testosterone therapy. Proper diagnosis demands deep, thorough clinical and laboratory evaluation. So that brings us to the actual solution: hormone replacement therapy, or HRT. Let's be crystal clear about the clinical objective here. The goal is restoring balance to healthier physiological levels. It is absolutely not about creating some kind of superhuman levels or chasing superficial anti-aging fads. It is an evidence-informed medical treatment designed to correct legitimate biological deficiencies. And making that distinction is vital because of the immense danger of misinformation out there. The internet is literally flooded with exaggerated promises and unregulated online programs that simply do not follow medical standards. I promise you, the secret to longevity isn't found in a suspiciously cheap bottle pushed by an influencer. We are dealing with powerful biological regulators here. Relying on commercialized shortcuts instead of responsible, evidence-informed medicine is incredibly dangerous. When you try to bypass responsible medicine, the serious health risks are very, very real. If mismanaged, you are looking at potential cardiovascular issues, blood clotting, liver dysfunction, metabolic disturbances, and severe mood instability. Because hormones are so incredibly powerful, using them without professional, individualized medical oversight is just a massive risk to your long-term health. It's just not worth it. So what does a responsible, clinically sound approach actually look like? Well, at Akkineni hospitals, they utilize a strict, safe hormone management protocol. Step 1 is a highly detailed consultation and history review. Step 2 requires comprehensive blood investigations, so they can see exactly what's happening inside. Step 3 is a deep clinical risk factor assessment. And Step 4 ensures continuous periodic monitoring. This rigorous, scientifically guided protocol is exactly what responsible medicine looks like. It prioritizes patient safety above absolutely everything else. But, and this is a big but, even with the absolute best medical protocol on the planet, we have to face a hard truth. Hormone therapy alone cannot replace healthy living. Hormones are incredibly effective at restoring balance, for sure, but they are not a magic wand you can wave to fix a fundamentally bad lifestyle. There are foundational lifestyle factors that literally no hormone protocol can compensate for. If you've got poor nutrition, chronic sleep deprivation, a completely sedentary lifestyle, sky-high stress, or excessive alcohol use, HRT is only going to take you so far. That is exactly why truly integrated medicine requires a comprehensive approach. You absolutely have to combine hormonal evaluation with fundamental lifestyle optimization to get any real, lasting results. Now, we really need to talk about the invisible toll. Hormonal imbalance isn't just physical. Many individuals silently experience severe emotional distress. We're talking about women feeling totally socially withdrawn and emotionally exhausted, or men dealing with a profound loss of confidence and massive relationship stress. It is so common for these struggles to just be dismissed as, oh, it's just stress, or you're overthinking. But this emotional distress is a highly legitimate and deeply treatable symptom of hormonal imbalance. Because true wellness is multidimensional, your treatment actually has to be too. That's why forward-thinking places like Akkineni hospitals don't just write your prescription and send you on your way. They provide nutrition guidance, fitness support and rehab, stress management, preventative screening, and sleep optimization. This entire integrated healthcare framework works to restore balance across all aspects of your life, significantly boosting your overall quality of life. And all of this ties into a massive paradigm shift in longevity medicine, the concept of health span. The ultimate goal of modern medicine isn't just to add years to your life, right? It's not just about extending your lifespan. It is about preserving your vitality, your emotional resilience, your independence, and your mental clarity throughout those years. It's about maintaining actual functional health so you can really enjoy the time you have. We are looking at a rapidly evolving future in healthcare right now. Precision endocrinology is advancing at lightning speed. The future of medicine is preventive, it's personalized, integrated, regenerative, and deeply wellness-focused. And the very best healthcare institutions are perfectly balancing this incredible innovation with rigorous scientific evidence and uncompromised patient safety. So as we wrap up this explainer, I really want to leave you with a question. Are you ready to reclaim your quality of life? You truly do not have to accept exhaustion, brain fog, or a loss of vitality as your permanent new normal. Look beyond the superficial, quick-fix solutions and seek medically sound, integrated answers. Ask yourself, are you currently just adding years to your life, or are you actually adding life to your years? Thank you so much for joining me, and here's to finally understanding our bodies better.